Do you know why we have cases so much? Because that's all we do is test. If we cut our testing down in half, they'd say, well, they wouldn't say that, but cases would go down in half. Now we have the best testing, and we are coming around. We're rounding the turn. We have the vaccines. We have everything. We're rounding the turn. Even without the vaccines, we're rounding the turn. It's going to be over.
President Trump again saying that we are rounding the corner on coronavirus, despite concerns as cases rise and, most importantly, hospitalizations in several states. More than 83,000 new infections nationwide on Friday, a record one-day increase since what we saw at 77,000 in July. So we are moving in the wrong direction, the medical professionals tell us. Trump ally and former New Jersey Governor Chris Christie appears to criticize Vice President Pence's decision to keep his campaign on schedule after 5 people close to Mr. Pence tested positive for the virus.
The whole getting of COVID to begin with and the not wearing of masks has been a problem. And I've talked about that over the last couple of weeks. And so I think everybody's got to put the health of the people they're going to be in touch with first. You got to keep yourself away from everybody, and I'm a little bit surprised.
I want to bring in now White House Deputy Communications Director Brian Morgenstern. Brian, thank you for being on the program today. My first question for you, with all of these headlines about the novel coronavirus, is what is the White House and the president's latest strategy for attacking this precipitous spike? Which, again, cases, yes, we're testing. It's the hospitalizations in places like Wisconsin and Texas where they're running out of ICU beds.
Well, Harris, I appreciate the question. The president's response really has been historic, and a big part of that has been the coronavirus task force constantly communicating with state and local jurisdictions, ensuring that they have everything that they need on a proactive basis. We've had FEMA, we've had Admiral Polovchek making sure that every jurisdiction has supplies, that they have personnel, that they have medications, that they have everything they need to make sure that the risks of this virus are much, much lower than they ever have been. And that's the case. And it's because of, with Operation Warp Speed, we have treatments coming to market faster than ever. Soon we'll have vaccines coming to market maybe 5 times faster than ever. And so people are not dying of this disease nearly at the rate that they were. We know how to isolate the vulnerable. We know how to treat people oftentimes on an outpatient basis. And so the risks just aren't what they used to be. We know how to safely reopen. We know how to mitigate, and we know how to treat people. And we have the resources there to do it, thanks to President Trump, the task force, and Operation Warp Speed.
You know, I want to follow up, and this is only based on the science. Coronavirus is, you know, the same type of virus that generates the cold. We've never had an effective or any kind of vaccine for that. So we are so hopeful, along with you, the president, the scientists, everybody, that we can get there with a form of the cold on steroids, if you will. But when the president says this is going to vanish, what exactly does he mean? And is that helpful for the American people?
Well, it means, Harris, that we shouldn't be locking down our country, and it's because we have reduced the risks so much with the treatments that are coming through the process. We're looking at the steroid dexamethasone. We have the antiviral remdesivir. We have Regeneron and Eli Lilly with the antibodies, and soon the vaccines that will inoculate not just our vulnerable populations and healthcare workers. We hope by the end of the year, we look like we're on track for that, but also the general population in the first half of 2021. And so we'll be in a place where the risks will be so low that we'll really be able to get back to life as normal, and we'll get people back to work, back to church, back to school, and we hope that they can do that now in a safe way, but certainly really getting back to normal in the coming months.
I want to drill down on the vaccine, maybe some of the conversations that the president is having with companies that you can share with us. And first this, though, and I've heard you say kind of in a different way, too, than even from what the president has said. He said on multiple occasions that a vaccine will be ready very soon. And in the debate last week, claimed it would only be weeks. Dr. Anthony Fauci, in a BBC interview, agreed, but appeared to kind of clarify those comments. Let's watch.
We will know whether a vaccine is safe and effective by the end of November, the beginning of December. The amount of doses that will be available in December will not certainly be enough to vaccinate everybody. You'll have to wait several months into 2021.
So, Brian, I'm curious what the conversations have been like textually that you can maybe share with the American people, the president, these companies doing what they can to build out this vaccine.
Yeah, I appreciate the question, Harris, and the opportunity to clarify. So what we're looking at really within the next couple of weeks potentially would be safety data showing that one or more of these vaccines that are in phase 3 trials could be safe. It will be probably another month. Dr. Fauci stated, towards the end of November, we're probably looking at both safety, efficacy data and the safety data. And then we are mass producing these vaccines currently so that by the end of the year, we'll be able to distribute tens of millions of doses. Those probably will go to the high-risk populations, the senior citizens, the elderly, those who are in a more vulnerable health state, as well as healthcare workers, those more likely to be exposed to the virus. But then over the coming months, on a rolling basis, we expect to increase that capacity to hundreds of millions of doses so that really anybody who wants a vaccine will be able to have one. It'll just be a rolling process as we go through it.
Real quickly, and it's got to be quick.
Sure.
I just heard you say that you're already mass producing some of them. So you're mass producing things, we're not quite sure yet what we're going to do with them. So you would just toss all those out.
That's right, Harris. What we've done with this process, and we've gone in parallel with the development, the safety, the data evaluation process, and the manufacturing process, so that if one is deemed safe and effective, it's ready for distribution really immediately. Within 24 hours, we can get doses out on the road. If one is not safe and effective, we would discard that. But Harris, this is about 5 times faster than the next fastest vaccine has ever been developed. And that's because we have a businessman president who really threw everything at this problem to solve it as quickly as possible. Nobody but President Trump would be this innovative, this entrepreneurial, and this determined to get this solution to the American people.
Brian Morgenstern talking about the innovation part of it. Of course, the part that we can't control is the science. And so we will watch to see what really can happen. Brian, good to see you today. Thank you.